Hello, I'm Dr. Mary Massey Story, Assistant Professor of Family Medicine and Clinical Assistant Professor of Family and Community Medicine at Northeast Ohio Medical University's College of Medicine. Welcome to Take Charge of Your Health. These videos are for educational purposes only and are not to be used for treatment or diagnosis of any medical condition. Please see your primary care provider for treatment and diagnosis of any medical condition or concern. I'd like to talk about living with asthma. This is a slide of a quick asthma overview. We'll talk about some asthma facts, we'll define asthma, talk about triggers, common treatments, and how to work with your primary care provider. Who is at risk for asthma and why? In most cases, we do not know what causes asthma. There are some people who are more likely to have the condition than others, especially if it runs in their family. It can start at any age. Children who have asthma at a young age may outgrow, quote unquote, some of these symptoms as their lungs develop. It doesn't mean they can't have symptoms that come back later in life. There are adults who acquire asthma later in life. And the symptoms of asthma can be mild, moderate, or severe. They can have bad years of asthma and other years that are relatively quiet. People with asthma don't always have to feel bad or have symptoms. We do not have a cure for asthma, but we do have treatments that can help the symptoms. There are about 25 million Americans that have asthma. That's 1 out of every 13 people. The prevalence of asthma is increasing in every age, sex, and racial group since the early 1980s. African Americans in the US die from asthma at a higher rate than people of other races or ethnicities. It is more common in women than men, more common in boys than girls. It's also more common in children than adults. It's the leading chronic disease of children, and it's the #1 reason for missed school days. So what is asthma? It's a chronic condition that affects the airway. It causes repeated episodes of wheezing, breathlessness, chest tightness, and cough. The symptoms can range from mild to severe and can happen daily or occasionally. This slide shows some of the symptoms we just talked about: cough, wheezing, chest tightness, shortness of breath, rapid breathing, and tiredness. Rapid breathing and tiredness is very concerning. Those symptoms sound like it's an asthma exacerbation that's pretty severe, and when people get those symptoms, they should be seeking emergency care. There are many asthma triggers. It depends on the person. So with asthma, the airways in the lungs are often swollen and inflamed, which makes them extra sensitive to things in the environment. And those things are called triggers. When the airway is triggered, it swells more than usual. That swelling narrows the airspace, so air doesn't move in and out very well. There are muscles that surround and wrap around the airways that can also tighten, making it even harder to breathe. When that happens, it's called an asthma flare, an episode, or an attack. This list shows a picture of some things that can trigger asthma. Starting at the 12 o'clock spot is exercise. There are some people who have what we call bronchoconstriction from exercise. And for those people, they oftentimes will take their asthma medication prior to exercise. Pollen, especially summertime, spring, and in fall, depends on the person and what they're allergic to. We have tree pollen, grass pollen, and ragweed, and they bloom at different times of the year. Bug droppings in the home, chemical fumes such as aerosols, hairspray. Cold air, especially going from a warm environment into cold air, can trigger someone's asthma. Fungus spores, dust mites, secondhand smoke exposure, strong odors, pollution, anger, stress, pet dander. These are all common triggers. I like this picture because it gives an idea of what the asthma airway looks like compared to normal. So on the left is a normal airway. Air can flow in and out very easily, no constriction. An asthmatic airway, the middle picture, that may be their baseline. That may be how their airway looks when they're not having any symptoms. So it's a little bit more inflamed, has some mucus in the airway. but air can still move in, but it's a little bit more constricted. They may have a little bit of symptoms there. The third picture shows an asthma attack, a very small airway that's getting in the way of air moving in and out, more mucus, more inflammation, and now the muscles that surround the airway are also tightening on an already constricted airway. That's an asthma attack. A very scary thing to experience. I can speak to that as a person who has this condition. There are medicines or medications, I should say, that treat asthma. And these are essential to asthma management. The variety of medications that are prescribed to help manage the symptoms. Some prevent the episodes from occurring, and others treat an episode once they're already underway. It's important to know the difference of how these medications work. And there's a source that I listed down below that talks more about some of these conditions and treatments and more about asthma in general. This slide shows the different kinds of medications that are used. On the left, you see controller medications. These are medications that are used to reduce the inflammation and prevent episodes from occurring. They're taken daily, sometimes twice a day, even when there are no obvious symptoms. They will not help during an asthma episode or an emergency. Again, they're used to prevent attacks. They're used to reduce inflammation. They do not work quickly. The second column shows quick relief medications. These are the ones that people go to if they are having a trigger, an episode, because their purpose is to relieve bronchoconstriction, which means they help to relax the airway of the tightened airway. So it relieves the tension in the muscles. They are designed for quick relief, and they are used during asthma episodes. They should be used when symptoms first occur. They should not be delayed in use. Some people will tell me, well, I haven't used my asthma medication because I was waiting to be more short of breath, or I was waiting to be wheezing before I use it. That's not what we want to happen. We want you to use those things earlier to hopefully prevent the longer and eventual process of asthma. So they are taken on an as-needed basis. The third row are oral steroids, the more controversial medication group. There are a lot of patients who have concerns about this one, but they are very necessary. They're important. They have a role. They begin to work within 6 to 24 hours of taking the medication, and their job is to decrease the swelling. The swelling that I showed you in the airway, where it's really tight, air is not moving, inflamed, mucus-filled, oral steroids help. They're taken over a short period of time, usually between 3 and 10 days, and they're, again, used to treat severe episodes. They are safe when taken short-term and as indicated by your medical professional. They are not the same medications that people take when they want to increase their muscle mass. These are not the steroids that people sometimes will abuse or use for other reasons. These are medical steroids. You should develop an asthma action plan with your medical provider, which includes medications. Again, I'll make the point in saying quick-acting medications don't control asthma, and controlled medications don't act quickly. Please know the difference in your inhalers. Vaccines are important to have. Flu, pneumonia vaccines are available. The flu shot's taken seasonally, that's once a year. Pneumonia vaccines are taken less often. Talk to your provider about the pneumonia vaccine. It's oftentimes given every 5 years. It depends on any underlying chronic condition. So protect yourself with vaccines. Triggers, the ones we talked about, it's important to know your triggers. Try to find ways to avoid them. If allergies are a trigger for you, talk to your medical provider about possibly treating the allergies, because that can sometimes help decrease the number of episodes that you have during those seasons. In summary, if you have asthma or believe that you may have asthma, please speak to your medical provider. Learn all that you can about asthma, and especially learn what your triggers are so you can try to avoid them. Take your medications as prescribed. If you develop an unwanted side effect, call your provider, the provider who prescribed the medication, and see if there's another medication that can be used in its place. Also, maintain a healthy lifestyle, exercise, balanced diet, stress reduction, and routine clinical appointments. Remember that you can control your asthma. This is a resource page that talks about asthma from the American Lung Association. There are some nice books that you can download. And there's a link below that talks about the different types of inhalers and their functions. I'd like to thank you for your time. I hope this was helpful, and take care of yourself. Bye.